I'm Lori Stokes, and recent research shows that gum disease may often be a sign of other health problems. Is it more prevalent than the common cold, and also affects an estimated 50 million Americans? Joining us today, Dr. Jonathan Richter, a great neck dentist specializing in periodontics, Lauren Kilmeade, a dental hygienist who educates patients about gum disease, and Leslie Lavore, a resident of Manhasset, whose gum disease was an early sign of diabetes. Welcome to all of you.
Thank you.
Thank you.
Let's talk first to you, Leslie. 8 months ago is when you were told that you had the early signs showing diabetics.
Yes.
Or diabetes, rather.
Yes, it was Lauren and Jonathan, Dr. Richter, who suggested to me, based on what they were seeing in my mouth, that I go be checked for a blood test for diabetes because my gums had shown changes that they hadn't had in the last several years that I've been using them as my dentist and hygienist.
And was this the first time, Lauren or Dr. Richter, that you had seen these signs? Was 8 months ago that perhaps we might have a problem here?
Most of the time, you know, what we start to look for in a patient when their gum tissues are not responding to treatment, when they come in for regular maintenance visits, it just kind of, you know, throws up a red flag to us that we have to look a little bit deeper when tissues are not responding to normal everyday treatment. So one of the things that start to show up very early on in the mouth is diabetes. So at that point, we were suspicious and we made the recommendation for her to visit an endocrinologist so he can do some further testing for diabetes.
What are some of the initial warning signs?
Well, treating Leslie for over the past decade, it was easy for me to see because no matter what, she was very conscientious with her home care, with keep brushing and flossing and doing everything I had instructed her to do. So when her gums weren't responding to the treatment, I knew there must have been an underlying health issue. And it was a gradual type of process. It wasn't one day, all of a sudden she came in and her gums were bleeding. It was more, it just wasn't responding. I'd like to see the gums a little bit healthier for coming in so frequently.
How often do you have cases like this where a patient comes in for a regular checkup, but yet you start to see signs that there's another problem?
Most people, unfortunately, are under the impression that they only need to visit their dentist twice a year.
If we can, yeah.
If you can. Unfortunately, that's great if you have a perfect set of teeth and you brush and floss every single day. Unfortunately, a lot of people have underlying, you know, histories and previous dental diseases, and you have to really look a little bit further. So what I try to do is actually, for each individual patient, set up an individual treatment plan and an individual sequence on how we should try and maintain them. Some people can come every 3 months, some 6 weeks, every 4 months, but it's individually dependent upon what you see and evaluate for that patient. And as we treat the patients, depending on how they respond during their treatment, many times we can often change that for them. It's not set in stone on what their treatment protocols will be. It's based upon what we see at that visit, and we set them up for the future.
And you've had to change your lifestyle, I would imagine, correct?
I have, and I also added an extra visit in to see them. I see them one more time a year than I had been. That helps a lot. And I'm eating better, I'm exercising a lot more, and taking just a tad of medication, and it's working out real well.
We have, for the viewers this morning, we have some of the warning signs that people should be alerted to. Maybe even they're able to see. Let's start with the bleeding gums. And Lauren, that's what you noticed with Leslie.
Yes, that's usually the first sign. And most people are under the false assumption that, oh, my gums always bleed. They think that's normal. But it's not. Healthy gums should never bleed. That's an important point that the audience should realize.
But at the same time, if you notice a little bleeding, should you all of a sudden run to your dentist?
Well, again, healthy gums do not bleed.
Really?
So yes, you should go and have an oral evaluation. Yes, I would say yes. Okay. Run? No, but maybe the early signs of gum disease, maybe give it a week or so, you know.
Okay, to be able
but
to
yes,
notice.
It's a preventative type of screening, and hopefully when you catch it in the early stages, then you can ward off the further stages.
We also have up there red or swollen gums, as well as another warning sign, and a bad taste in your mouth or even bad breath. Doctor?
All these are warning signs, and unfortunately, many people don't even know that they have them because there's no pain associated with it. And they're so used, based upon their past history, that it's normal to have bleeding gum tissues, they take it for granted. But no differently, if you were to touch your hand and your hand was to bleed, you would run to the doctor.
Absolutely.
They just don't do that for the mouth, but it needs to be brought to people's attention that any tissue that bleeds needs to be addressed. And it's very important in the mouth because What's causing the tissues to bleed are ultimately that bacteria causing the tissues to be ulcerated. And these bacteria have the ability to enter the bloodstream, and they have the ability to travel throughout the body wherever the blood will take it. And some of the things that, for some patients, in a bigger systemic link, will be many patients know that before they have to go for dental cleaning, they're often told that they have to pre-medicate because they've been told early on in life that they may have a heart murmur.
Right.
And the reason for that is they're worried about the bacteria that are stored up in the mouth entering the bloodstream and really doing damage to the heart valves. So right there you have a very, close link between the mouth and the heart.
We have some other warning signs. So let's take another look at, as you were talking about that, if they're loose or sensitive, if they pulled away from the teeth. Certainly that is something that you would be able to visualize and notice without any problem. Pain when you're chewing, or a change in the way that the teeth fit. Is that a shifting almost?
Yes, and unfortunately, though, most of these symptoms, the latter one that you mentioned, is in the later stages of gum disease. So that's what the most important part is, for people to realize that sometimes there are no symptoms at all. And that's the point where brushing and flossing and regular visits really will help to prevent all of these symptoms.
And this can happen at any age, or is it primarily once you're a little bit more mature?
Any age, you're susceptible,
Really?
from adolescence all the way through adulthood.
All right, it's good information. I think now when we brush our teeth or smile in front of the camera or the mirror, we will make sure we take
they'll be
extra
flossing their teeth a little bit more.
Dr. Richter, thank you. And Lauren and Leslie, thank you. We appreciate you being with us this morning.
Thank you.
Thank you.
For more information regarding all the organizations and the guests featured on Viewpoint, you'll want to visit us online, 7online.com. We're coming right back.